Dr. Bethea, welcome to Let's Talk.
Thank you so much for the invitation.
Yeah, so you are, I want to talk a little bit about you and your background and the passion I think that you have for this project. But you are a cancer researcher at Georgetown Lombardi Cancer Center. Tell us what that work involves. What do you do?
Attend a lot of meetings. But my research primarily focuses on cancer disparities. So basically, why do certain groups of people get cancer, get more aggressive cancers, have more struggle after a cancer diagnosis, with particular focus on environmental exposures, like where somebody lives, what chemicals they're exposed to, as well as sleep health, right? How long does someone sleep? How quality is their sleep? And how do those things really affect someone across their cancer journey?
Interesting. And so, we know that we know about the disparities when it comes to breast cancer, particularly as it relates to Black women. It seems as though we um, die more from breast cancer, disproportionately more than other people. But what that's related to, many people don't know. So can we talk a little bit about your research and some of your findings, what those disparities are, and maybe what you have found causes them?
Sure. So there's multiple things that are really happening here with that disparity. Some of it is biological because some of the more aggressive types of breast cancer, where our treatments just don't work as well, are more common in Black women compared to white women, like triple negative breast cancer, basal like breast cancer, are those really aggressive tumor types. And then some of it is not biologic. When we have women who have similar diagnoses, but for some reason, Black women are more likely to die of their diagnosis or to kind of do more poorly on the same treatment. And so, some of the things that we're learning in research is that there may be clinical factors. It could be information that's not being provided. It could be factors in the woman's life. Maybe there's an issue with being having enough food to eat to balance out the medication, affording the medication to stay on top of the schedule, whether you're getting radiation every day. Can you do that? Can you keep buying the prescription medications that are very expensive? There are some things we just don't know yet. Could it be that it's a waste? Different people metabolize some of these treatments. So it's kind of a wide variety of things that are happening at the same time, which is why it's so critical for us to do research and make sure that Black women are a part of the conversation, not just samples that we're using, but talking to patients and survivors and caregivers and communities about how they're experiencing cancer and what might be the things that people struggle with, what might be the things that we can change um, to help people have optimal health the way they define it, and what are the things that we may not be aware of that are happening in the clinic space that we can think about structural changes to help everyone have the opportunity for the best health.
So the voices for Black women, this evidently the research said, we need to do something specifically for this segment of the population. Tell us a little bit about what that is.
So, Voices of Black Women is a study where we're recruiting up to 100,000 Black women across all 50 states and DC, women who are between the ages of 25 to 55 who identify as women, identify as Black, to really get some more information about folks' cancer risks, for folks' health and well being. So, we recruit women and we follow them about like a check-in like twice a year to find out about what's going on with their health and their life and follow them over several years. And so, what that's going to help us do is understand more about the way life is right now in kind of the largest study among Black women specifically, and how things that are happening in their lives, multiple things at the same time, are influencing cancer risk, as well as how well people do after cancer diagnoses and the other things that we get diagnosed with along the way on both sides. So much of cancer research only recruits people who are healthy except for their cancer, and oftentimes that's just not the experience of Black women. and some of the wonderful studies that have happened or are ongoing, like the Black Women's Health Study, the questions that they asked in 1995 may be a very different experience than Black women are having right now in their 20s, 30s, 40s, and 50s. So we need to know, what are people experiencing right now? What are the technologies that people are getting information from right now? What are some of the places people are living right now that will help us learn as we move forward of how to what are the gaps that aren't already in clinical practice, that we aren't already aware of in research? Where are those gaps? What is important to Black women? Because we're also asking, not just fill out a questionnaire, but tell us what's important to you and how we can share information back to you in a way that you want to hear, that you feel like is useful for you and your family. Um, to really kind of make sure the rising tide rises all boats, instead of some of the things that we've seen is where some really wonderful medical advances that involved Black women's data or Black women's specimens, their blood, sweat, tears, all the things of life experience. And then when it comes into clinic, or when it comes into the general population, Black women don't have access or aren't benefiting once it gets into a real world setting out of a clinical trial. And we really need to bridge that gap.
You said a couple of things, and that one is reporting back. A lot of times people may decide to participate in the study. They may not. I don't know. And I think that's part of why, you're here to encourage Black women to participate in this study, so that we can sort of break down some barriers and misconceptions and what have you. Word in Black, an organization that the Washington Informer works with, had a study done, a research, a survey. You said surveys, but survey. And one of the things that it found is that Black women just are still fearful of getting mammograms. So, I'm wondering, do you have any opinions on why that may still be the case, particularly since we have been told that early detection can save lives?
Yeah. So I will, full disclosure, my research is not in screening and screening barriers.
Right, right.
But I've been a Black woman for a long time, and I've been around Black women for a long time, longer than it looks. Um, but I think, it's very common. Like, we know it's not a comfortable experience. It's not a great procedure. Squeezing the tissue through metal plates, you're exposed, it's cold. You hold these uncomfortable positions, you hold your breath. So it's just not a great experience. So it's a normal thing for a person to avoid an experience that seems like it's going to be painful, and it's not clear what the benefit might be. So I think we talk about the benefits of mammography, but don't necessarily reach people with the importance of, like, how that benefit is very personal, so that they can do that calculation. Because if you have to take off a whole day, you can't wear deodorant until it's scheduled. Sometimes you have to wait months, and then it's like, well, I don't have time now. There have been some more recent, in the past few years, changes and recommendations. So sometimes people can feel like, well, what does it really matter if you're not sure if this is going to help, if you're not sure how often you need to do it, if maybe it's free, but maybe it's not free, because the screening mammogram is covered as preventive care, but the diagnostic mammogram, if you need to follow it up, may not be covered by insurance. So people are doing a lot of calculations that make sense. So I think sometimes it's communicating with people and being clear about what we do and don't know. I think there's also sometimes people are afraid that, well, what if I have a cancer and I do the mammogram and it squeezes it and it spreads the cancer? Which kind of makes sense on its face, but that's not how it works physically, like biologically in the body. And so sometimes being clear about that is very important. Sometimes people will have a shadow, and it's very scary until you find out it's not something. But then other people, like, hear that story, like, well, I don't want to go because what if I have a shadow? And
Yeah,
that's okay. And it's talking about, well, so maybe you're not comfortable going every year. Could you go every other year? Or maybe it's a conversation that you have with a health provider, or if there's a mammography van, to
mm,
talk about it. And so maybe you're not ready this year, but maybe keep talking about it and next year. So sometimes I think we just don't make the time and the space to talk about it.
right.
Um, in clinical encounters, if you have 12 to 15 minutes, you have a whole list of things, maybe there's not time, but where are other places we can talk about it, I think are really important. I've had multiple mammograms. It's not a fun experience anytime, but I'm so thankful that I have access to it.
Correct.
Has it has benefited me.
Wonderful. And so for this Voices project, Voices of Black Women Scientific, I mean your board, you have about what? How many women have you signed up so far to participate?
In the DC area, we've got a little over 400,
Hmm.
which is fantastic.
Oh, good. Okay.
Across and I think it'll be great to have even more from the DMV because it's such an eclectic area.
And what does it take to sign up? I mean, what is there any criteria? Have you had experienced breast cancer, or what makes you a candidate to participate?
Sure. So any adult woman aged 25 to 55 who identifies as female, identifies as Black, has
Right.
never had cancer other than certain types of skin cancer, and lives in any of the 50 US states or DC can go to the website voices.cancer.org and can sign up where they'll kind of complete a little eligibility questionnaire that asks them about those things. And then they can complete a baseline questionnaire, which is kind of a little bit longer, just kind of cover a lot of different things, but people can skip some of the questions. And then about every 6 to 8 months, they'll get another questionnaire to update any information. People who are interested in sharing more of their data can contact Voices. There will also be some different sub studies to learn about specific things. They can participate in any of those. There will also be some opportunities to connect locally. So if someone's not eligible, like for example, I've had breast cancer, so I'm not eligible, but you can support the study in other ways, like being a Voices ambassador by connecting community organizations to Voices, to telling people who may not have heard about it, and the potential that it has to really help be a game changer for Black women over time. Any of those things.
And is there an age range, or does it matter? I think you mentioned that earlier. I mean, you could be, I guess, over the age of 18, I would think, but I don't know. Is there an age?
It's 25 to 55.
Okay, all righty.
Mhm.
And again, because I didn't hear that part clearly, are you saying that you either have experienced breast cancer or not?
Have never had cancer except for a couple types of skin cancer. So no cancer ever diagnosed.
Okay. And is there any, I know you said sometimes that there's a gathering of women, sometimes, there may be some time during this study. Would they come together? Do these women ever get a chance to kind of come together under um, uh, the board's group or Lombardi group or something, just to kind of connect?
I mean, I wish like
1,000 people, I know.
yeah, it's a little bit, yeah. So there are different webinars that the Voices study team hosts, where any of the participants, anybody who's interested, can hop on and learn about what's going on the study. There are also opportunities with local American Cancer Society events. More than welcome to attend any of those events. I'm hopeful that there will be some more kind of Voices focused events in the future, but the principal investigators, will announce those if any as time comes. So I think those are great opportunities because the study does protect people's data. There's not like going to be a Facebook group or anything where people can just hop on necessarily, because you can't just give out people's information. If people decide to share that they're a member of the study, they can do that. But there's kind of that balance between privacy and data protection, and all of the kind of exciting things that I would love to see happen, but maybe it's just not quite time yet.
Yes, like what? But Dr. Bethea, what would you like to see happen?
I mean, I love the idea of bringing people together, and maybe in 10 or 20 years, of bringing people together, kind of talking about their experiences, learning from each other. Some of the information that's been gathered in questionnaires, as it's reported back to women, getting women together and be like, well, how does that read to you? Is that your experience? What are the things that we have our 7 item question about this topic, but does that make sense to you? It's a validated measure, but does that feel real? What does it sound like? What does it live like? What would you want to do with this information? How does it maybe resonate to what you might want to teach the young ladies in your life? What are the things that you wish you knew 10 years ago, and how can we make sure that we're getting those messages out? So that's a little bit beyond the scope of voices, but I'm really excited about that's something that we may be able to do in the future as we get more information from such wonderful women who are willing to share and participate in this study.
And how does this information that you get from women who participate in the study, how does this information reach out and inform health providers,
Mhm.
insurance companies, health practitioners? I mean, will they take this information and maybe apply it to their practices? Are they connected to this as well?
So we believe so, and so that's something that we've seen from some other studies, like I mentioned before, the Black Women's Health Study. Some of the papers and research done by that study has really informed some of the guidelines and recommendations around breast cancer screening for Black women. For some of the conversations, even about like childbirth and lactation, why is it important if you're able to breastfeed after a baby? What might it mean for your risk of breast cancer? Some really important things that come out of studies like this one, big studies where we're able to follow women over time, and they're so generous with their life experiences. And we believe that that will happen moving forward as well. And some of the information that we learn can also inform clinical trials, can inform community-based interventions, because we'll know from a broader group of Black women, not just the small group of Black women who are very well informed or very well connected or very affluent, but a wide group of diverse Black women, because we know it's a diaspora. It's not like a monolith of a certain type of woman. And so that means we really need to hear from everyone. And once we've heard from a lot of different women, then we can be thinking about what are those approaches that will work for everyone, or if not everyone is affected, that's useful to know. So how do we help women who are particularly affected by a particular exposure or a cultural phenomenon? So we'll have that information to do those more tailored approaches, as opposed to just this is the thing for Black women,
Yeah.
which we know doesn't isn't necessarily as successful as we might want it to be.
Right. So before we close, I'm going to ask you to give that 30-second, like that pitch, because I mean, I know you said 400 and from the DMV is a good number. I'm sure we're trying to reach 100,000 throughout, so we want to make sure our group,
Yeah.
our area is represented because we have different, environment, like you said, says a lot about
Yeah.
our health. So what's that pitch?
So I would say, when Black women haven't been included, health improvements haven't benefited everyone equitably. When Black women aren't included, we miss information that can help us have better health. When Black women aren't listened to, our bodies and our experiences are treated like commodities rather than being respected and honored as fully human with inherent value. And so I would say we're done with that. So let's get engaged. If someone doesn't want to participate, you're not comfortable, that's totally fine. Become an ambassador. Help us do what we're doing better. Um, get involved with research as an advocate or a volunteer, so we can change the culture so that it is a safe space to be involved in research, so that things don't keep being done without us, or where our blood, sweat, and tears are being used, and then by the time the intervention or the medication hits the market, we don't have access or it doesn't actually work. That's not okay. And it's time for us to change that. And we have to lead at the front. Nobody's going to come do it for us, as we've seen so far. So let's be a part of the solution.
I love that. Done with it. Dr. Bethea, where will folks go? I want to put that up on the screen again for people who do want to know more about the study and can participate.
Absolutely. So it's voices.cancer.org.
Okay, voices.cancer.org. Now we put something else up here, but can they get to it from this site as well?
Sure. Yes.
Okay.
So
All
if they
right.
like go to American Cancer Society or they Google Voices of Black Women ACS, they can get there as well.
Okay, wonderful. Thank you so very much, and thank you for what you do. As I say, thank you for your service. I mean, we need people like you in places where you are, who can communicate with folks who are there, but also with us. You know, to bridge that gap. You know, to make us more connected, so that we have a healthier community. I appreciate you.
That's so kind. Thank you.
Where do you